So we are pretty close to the Pfizer and Moderna vaccines showing up at health systems, right? So it's going to be limited quantities in December. It will grow a little bit in January, probably full supply chain and everything by February. So we're looking at some interesting decisions to make in December. Like, who gets it, right? Who gets the vaccine? Now, the instructions from the CDC is, somebody referred to me as vague. I don't think it's overly vague. I just think there's a lot of room to maneuver within the recommendations. And so obviously frontline workers, hospital workers are in that first category. But if you only get, let's say you only get, I don't know, 2,000 doses of the vaccine. And by the way, the vaccine is a initial vaccine plus a booster. So you have to get the second thing. And we're going to come back to that in a second. So you have the challenge of, hey, we have more workers, more frontline workers than we have vaccine. So you have to decide who's going to get it. I know a lot of health systems right now are doing surveys of their frontline workers, of their healthcare workers, to determine who wants the vaccine. And this is a highly politicized thing. I'm hearing everything from people are lining up to not even all the people who are donning and doffing their PPE every day want to get the vaccine. So interesting challenge right now around this. First of all, I think the survey makes sense. Figure out who wants to get it. Second of all, you have to determine who's going to get it. You have to determine who's paying for it, right? I think in some cases it's mandated that you can't pay for it. In other cases, you may need to charge insurance or something for it. I think those questions need to be answered. The logistics of this are pretty interesting as well, just in terms of the two having to administer 2 doses of the vaccine for full potency of it, creates a challenge, because you're going to give the first one and then you have to ensure that they're going to come back for the second one. So there's going to be a follow-up mechanism. At some point, you're going to have to determine, are you going to have walk-ins? Are you going to have a scheduling situation? Are you going to integrate the scheduling into your digital platform in order for people to just go in there, schedule to get the vaccine, make the scheduled appointment? Are you going to deliver that in the home? Are people actually going to go out to the home to deliver that? Is that a safer way? Are you going to bring them into the clinic? Are you going to do drive-through? There's an awful lot of logistics to be done around this vaccine, and it's come at us pretty fast and furious, but we knew it was coming, and I hope we have those plans in place. And then the other thing I'm talking to CIOs about is marketing. We just yesterday we had 3 former presidents. I think it's 3, maybe 4. No, I think it's 3 former presidents said that they were going to take the vaccine right up front. And I think we need more moves like that. The reality is the most trusted source of health information in the community is not CNN or Fox. It is the local hospitals and the doctors in those hospitals and your primary care physician. So I think our marketing groups are going to have to flex some new muscles to really lead the charge in changing the perception of the vaccine and driving those numbers up.